Welcome, everyone. I have the honor and pleasure to introduce our keynote for this afternoon, Dr. Stephen Stack. He was appointed Commissioner for Public Health for the Commonwealth of Kentucky in February of 2020 and was subsequently elected Secretary-Treasurer of the Association of State and Territorial Health Officials in the fall of 2020. Dr. Stack is a board-certified emergency physician with more than 20 years of emergency medicine clinical practice and emergency department management experience. Throughout his career, Dr. Stack has served in numerous medical professional association leadership roles. In 2006, he was the first board-certified emergency physician ever elected to the American Medical Association Board of Trustees, and in 2015, he served as the youngest president of the AMA since 1854. Dr. Stack has extensive experience in healthcare policy at the federal, state, and local levels. Presently, he's adjunct professor for Health Policy and Advocacy at the University of Tennessee Haslam College of Business. He also has significant management in health information technology, as well as physician licensure regulation and assessment. He was born and raised in Cleveland, and Dr. Stack graduated magna cum laude in classical studies from the College of the Holy Cross in Worcester, Massachusetts. He completed his medical education and emergency medical residency at The Ohio State University and his MBA at the University of Tennessee Haslam College of Business. He is truly a Kentuckian now, and we welcome and we offer this floor to Dr. Stephen Stack, Commissioner for the Kentucky Department for Public Health. Welcome, Dr. Stack.
Thank you. It's a pleasure to be here, Vivian. Thanks for the nice introduction, and thanks for all the work you do with us at Kentucky Department for Public Health, Advancing Health Equity, and at the Foundation for a Healthy Kentucky. It's a privilege and a pleasure to be here today to talk with you about the importance of immunizations in Kentucky and in society in general. I'd like to give you some perspective, first of all. There'll be plenty of people over the next day and a half that talk with you in much more detail with a lot more facts and figures. So I'll try to use those data points to illustrate the themes I'm sharing, but I'll rely on others who will give you much more granular presentations, probably with charts and graphs over the next day and a half. Public health is really, really important to society. Unfortunately, it's not always valued for the importance that it has. One of my friends and colleagues, Dr. Craig Humbaugh, who's the Director for Public Health in Lexington, Fayette County, in a recent interview he had described his patient as being the entire community. So in my previous life in emergency medicine, I assisted one patient at a time, often at some of the worst moments in their lives. As a public health commissioner, I and the team that I had the privilege to serve alongside of worked to treat the entire patient. Bonnie, are you not able to hear me? Okay, I'm sorry. So we treat the entire community as our patient instead of the individual patient. And that has great implications for all of us. Public health over the last century, so from 1900 to 2000, had numerous accomplishments. And I would assert that those accomplishments of public health are really what advanced life expectancy the most. It was not predominantly the singular successes of treating individual patients, but rather the actions we took to try to help society overall. So let's just consider some of the things public health has done. Immunizations, and I'm going to assert that that's got to be one of the very top of the top 10. Motor vehicle safety, seat belts, airbags, things like that, helmets for motorcycles, safer workplaces where we've changed environmental rules in workplaces, the control of infectious diseases, learning how to prevent disease through proper hygiene and sanitation and ventilation and other interventions, the decline of deaths from things like coronary artery disease and stroke because we've changed environmental conditions, hopefully safer and healthier foods, though we've got a very long way to go there. Paying closer attention to maternal fetal health and trying to help have mothers have healthier pregnancies and children have healthier births in early childhood years. Family planning tools, which have helped to provide the opportunity for families to take more control over their reproductive potential. The fluoridation of drinking water, which is something we probably take for granted and how its impact is so substantial on reducing dental poor hygiene, which is a particular problem here in Kentucky, and also the widespread recognition of tobacco as a dangerous and serious harm, and also the steps we've taken to decrease the rate of initiation of tobacco use in young children. So in the context of all of those, I would assert that vaccinations have arguably been one of the very most impactful interventions we've done in the public health community. So just consider this. We have entirely eliminated the disease of smallpox from the human population worldwide. Smallpox had a mortality rate of 30% or more when it was in circulation, and it circulated for quite a long time without ever going away on its own. So the very thought that these diseases will burn themselves out by infecting everyone and that we will all somehow as a species then be protected has already been shown not to work. And what remains, though, is when we don't use vaccination, the disease continues to flare up from time to time and cause horrible harm. I think smallpox is particularly a good example of that, because at a 30% mortality rate, you're talking about really substantial risk of dying if you get that disease. Think of polio. That was a really remarkable success of the prior century, where numerous individuals worked using different methods and different approaches to try to find a way to create a vaccination that would immunize children, particularly from infantile paralysis, which every year caused large numbers of children across the country and the world to be victims of permanent incapacity because of that viral disease. Then we had more than one different approach to vaccination, both of which have subsequently showed themselves to be useful in different circumstances. And now, with rare exception, polio has been eliminated in nearly all developed countries around the world and only remains in a very small number of places. It is one of the tasks globally to try to eliminate polio as a disease in the human population, though that task has been diminishingly or particularly difficult and hard for us to get to the final pockets of polio. Consider measles, mumps, rubella, pertussis, tetanus, diphtheria. All of these are conditions which previously caused substantial harm across large populations of people, and now which are largely, if not entirely, preventable and manageable with vaccinations. Representative Chandler talked beforehand about chickenpox. People have lost sight of, and current clinicians have barely seen cases of chickenpox, whereas folks like me, I'm just about 50 when I grew up, remember very clearly having chickenpox and having an outbreak all over your body. And unfortunately, it caused harm to a substantial number of children. And what we lose sight of additionally is when pregnant mothers have some of these viruses and pass them to their newborn child, you can have particularly incapacitating and irreparable harm caused to the newborn children. So these immunizations have been incredibly powerful and incredibly impactful. And in fact, they're so impactful that at this point in time, CDC recommends vaccination for children, for newborns and for children, for about 14 specific diseases. And these have become a norm in our lives. It's something that I think we, at our own peril, take for granted because we don't see the harms these diseases once caused and will cause again, in large part because immunization rates are high enough to keep the diseases in check. But as Ben shared before, the skepticism that goes with, in some communities, with vaccination, and unfortunately, some measure of pushback on vaccination has raised the specter of increasing outbreaks for some of these conditions. And if we're not careful, if we are not all vigilant as a community and a society, we run the real risk of having these diseases return as serious human scourges, causing harm for all of us. Let me rattle off here real quick. For the recommended vaccinations for kids: hepatitis B, rotavirus, diphtheria, tetanus, pertussis, Haemophilus influenza B, pneumococcal vaccination, polio, measles, mumps, rubella, meningococcal vaccine, varicella vaccine, hepatitis A, and influenza recommended annually. For adolescents, we add to that some boosters for the tetanus, diphtheria, pertussis. We add human papillomavirus to this, which can help prevent cervical and other genital urinary cancers. These vaccines, again, are really modern medical miracles and have shown themselves to be incredibly impactful. And in aggregate, these vaccinations, along with those other public health interventions, have helped add more than 30 years of human life expectancy in the prior century. That is an incredible human accomplishment and a remarkable celebration that we should share together. I think it's really important to crosswalk that to where we are with the current pandemic with COVID. So in recent years, human life expectancy in the United States of America has unfortunately regressed or declined. Now, problems such as the opioid epidemic, which is its own enormous problem, have contributed directly to that. But really astoundingly and tragically, in a single year, in just the year 2020, it would appear that human life expectancy dropped in the United States by about 1.5 years. So the CDC reported that USA life expectancy dropped from 78.8 years down to 77.3 years in the years 2019 to 2020. That's incredible. To have a whole year and a half shaved off of our average life expectancy is absolutely staggering in such a short period of time. And the CDC estimated that 75% of that decline was caused by COVID-19 deaths. So just to put that in perspective, COVID-19, which did not exist in the human population until late 2019, in the span of 1 year of circulation, actually less than 1 year of circulation in the United States of America, went from non-existent to the third leading cause of death nationwide and here in the Commonwealth of Kentucky in the span of less than 1 year. And it was not until mid to late December in 2019 that we had a vaccine. Now, I want to focus on that just for a minute. I think the COVID-19 vaccines truly are one of the amazing modern medical miracles and also one of the wonders of modern science. In the span of really about 8 months, maybe a little bit more, we were able to sequence the human genome, design vaccinations, test those vaccines, and have them in production in the human population by mid-December 2019. So the sequencing of COVID happened in January. All the other development happened after that. And certainly in about 11 months, we had vaccines that we were deploying in the human population. Now, in that span of time, those vaccines have been deployed more rapidly and more widely than probably any other single pharmaceuticals in all of human history. So I've got on another computer over here the World Health Organization's website. The World Health Organization reports through September 15th that 5.6 billion with a B, doses of COVID vaccine have been administered worldwide to more than 3.25 billion persons worldwide. Just think about that. In the span of less than 12 months, here we are not even at the middle of September, so October, November, so in 9 months, 3.25 billion human beings have been vaccinated with COVID-19 vaccines worldwide. At this point, in the United States, the similar figures for that are that 2.16 million, it's 181 million Americans are fully vaccinated, and 466 plus million doses of vaccine have been given in the United States with incredibly high safety margins and incredibly high protective value against the horrible disease that is COVID-19. And as you've all seen in news reporting and hopefully in the data that we've shared from the Kentucky Department for Public Health, overwhelmingly, the vaccines protect people from the worst harms of COVID-19. And the folks who unfortunately suffer the worst harms at present are overwhelmingly unvaccinated. So For all persons in Kentucky who are being newly diagnosed with COVID, 90% or more of them are unvaccinated. For all persons who are in the hospital for COVID, 91% or more of them are unvaccinated. And for all deaths caused by COVID in recent months, it is 85% or so are unvaccinated. So here we have yet another example of the incredible power of vaccination and immunization to prevent horrible adverse harm. And the fact that humanity was able and our scientists to do this so quickly is really, really quite staggeringly impressive. Let me crosswalk this back to immunizations in general. So there was an MMWR from CDC last year. I want to give you just some perspective here. First of all, this is always multifactorial. People without insurance, health insurance that is, do poorly. They live sicker and die younger compared to people with health insurance. And this is one of the reasons it's so important that here in Kentucky, the governor has continued with the expanded Medicaid program and has also taken steps to help increase enrollment in health insurance across all Kentuckians. This is pretty clearly shown that people who are uninsured live sicker and die younger simply because they don't have access to care, preventive and curative when necessary. So looking at the CDC data for the years 2019 or 2017 to 2019, I want to give you some rough examples here. So if you have private health insurance, the likelihood for children by age 24 months of having received 3 or more doses of diphtheria, tetanus, pertussis boost shots is about 96%. If you have Medicaid, it's about 91%. And if you are uninsured, it drops all the way to about 85%, a full 10% less than in absolute terms than individuals with private health insurance. If we take hepatitis B, the vaccination rate is not as high. It's 77%, and it only falls to about 73% for uninsured. But again, here we have a lower uptake for that particular vaccine. The combined 7 vaccine series, this would be the traditional childhood vaccine series, has, and this is nationwide data, has about a 77% completion rate for private insured, but it only has a 51% completion rate for uninsured. So making sure that our populations have access to health insurance so they can access preventive and treatment care when necessary is absolutely essential to make sure that individuals have access to vaccination. It also shows that despite our successes, as I rattle off some of those numbers, we've still got a long way to go to get vaccination rates to be near universal, as close to 100% as possible. Now, tomorrow, Dr. Amy Harrington, who is with the Kentucky Department for Public Health and our immunization branch, will give more specific Kentucky data, but just a few little highlights, a few little teasers. Vaccination rates last year declined substantially in the early months of the pandemic. In fact, at their worst, we were approximately 20% decreased in the administration of new vaccinations compared to the prior year in 2019. This was due in large part during the phase where people were asked to stay at home to reduce the transmission of COVID at a time when we knew so little about the disease, where its mortality was so high, where we couldn't get PPE, personal protective equipment, to keep healthcare workers and others safe, and where we needed more time to try to figure out what steps in a more focused way we could keep people safe and how we could better treat COVID-19. So the trade-offs were necessary, but the trade-offs were also not insubstantial. And vaccination rates, as people stayed away from healthcare settings, declined. That's the bad news. The good news is that the vaccine rates have returned to a higher level, though not quite back to what we would like them to be from the 2019 year, and not yet anywhere near where we would like them to ultimately be. So I thought I'd give you use a few of these by way of comparison, just to show how Kentucky compares to the United States of America. So at cdc.gov, if you want to Google, they have dashboards, which are really neat. There's a child vax and I think a teen vax dashboard. And you can go in there and you can pick which vaccine series and how many doses you want to look for. And you can graph the United States of America compared to Kentucky and any other state in the database. So using children born in 2016, the vaccination rate for the combined 7 series of childhood vaccines by age 24 months, so by age 2 years, was about 68% or so nationwide. And in Kentucky, we were about 69%. So we were just slightly above the national average. 1 year later, so now the year that's impacted by the COVID pandemic, it dropped to 61%. So that's a pretty substantial decline in a very short period. Measles, mumps, rubella, children with greater or equal to 1 dose by the time they're 2 years of age, 92% in the United States. In the pre-COVID year, 91% in Kentucky, so here we were a little behind the national average, but it fell to 85% in Kentucky as a result of the COVID-19 impact. I'm gonna give you 2 more examples. Diphtheria, tetanus, and pertussis, 1 dose or more in those reaching the age of 2, about 88.5% nationwide in the United States pre-COVID. In Kentucky, we were better than that. We were 89.2%. And remarkably, this particular vaccine series, we increased slightly post-COVID up to 90%. So we managed to hold our ground there, I would say. Varicella, though, and again, this is chickenpox. This is what Ben talked about at the very beginning. Varicella only has about a 60% uptake rate in the United States as a vaccine. In Kentucky, it's only about 55 to 56%. It did slightly increase last year, which is good, but at 61%, we've still got a very, very long way to go to get the varicella vaccination to the kind of levels that we need to reach. So to give a little perspective here then, and then to sum up this part of what I was going to share with you, vaccines are clearly one of the true human accomplishments of science. They have helped add arguably more quality adjusted life years to human longevity than almost anything else. Sanitation, fresh running water, those probably can rival that accomplishment, but it's really large-scale public health interventions that have really had the greatest impact on helping people live longer, healthier, happier lives. And those impacts are far greater than the other incredible accomplishments of science and medicine and surgery that help us treat people when they're injured and when they're acutely ill. But here is a great example with vaccines where an ounce of prevention is worth many, many pounds of cure. On this shelf, this bookshelf behind me, I've got some books right up over here. I actually read some books on pandemics during the pandemic, which was an odd way to try to escape my job, I suppose. But those books were about Ebola, the Ebola outbreak in Africa, about the Great Influenza in 1918. So that was one of the more lethal modern era global pandemics that killed 50 to 100 million people worldwide at a time when the global population was much smaller than it is now. And then some other books up there about polio and the development of the vaccines related to them. The theme here is very clear, though, is diseases that wrought great harm in humanity. When medicine and science was able to find a way to create a vaccination, it was able to bring to bear or halt the great harms that were caused by those diseases. It's been shown time and time and time again. And now we have the most current example of that is COVID-19. So I do want to touch on here briefly with COVID-19, the situation we find ourselves in presently. So in Kentucky, we have some success in our vaccination accomplishments. We have 59% of the total population has received at least 1 dose of vaccine. That's 59% of all population. When we filter that out and just go to people over 18, it goes up to about 72% of the whole population. And when you look at the population 65 or older, it goes up to 91%. So that's a really strong accomplishment in the population 65 and older. But when you average numbers, it really doesn't tell the full story. We have wild disparity across the state based on geography for what vaccine uptake is. So if you go to the counties with the lowest vaccination rates overall, you go all the way down to 31 to 34% of those counties have had at least one dose of vaccine. Whereas when you go to the counties with higher uptake, the top 5 have somewhere between 70 to 76% of the entire population is vaccinated. So when you have a variation of more than twofold between the lowest states and the lowest counties and the highest counties, the average statewide does not tell the full story. We have communities in Kentucky that are still in incredible danger from COVID. And unfortunately, as I sit here and talk with you today, we have hospitals across the state that are in severe distress because there's not enough people and materials to treat all the people who are presenting with COVID-19, and also treat at the same time people who have non-COVID problems. And so we have situations where a lot of patients with non-COVID conditions are having to wait longer periods of time or have their treatments postponed while the hospitals struggle to try to just keep up with the COVID patients in their immediate and acute needs. So we've got a long way to go to get these vaccination rates higher, but it is absolutely essential. So again, I'll use COVID because everyone's familiar with this example because it's a present example. We have a disease that when it first came out, when we first had it last February, March, and April, that version of COVID, every person who was infected probably spread it to 1.5 to 2 other people. But now that we fast forward to the Delta variant, estimates now say that every one person with the infection may spread it to as many as 6 other people because the virus has become that much more effective in transmitting itself from one person to another. Unfortunately, what that means is in order to reach community immunity, or what other people would call herd immunity, we probably now have to have a vaccination rate over 90% because the disease has become so easily transmitted. So even the success that we have here in being able to say that, look at this, 59% of the whole state, all the people vaccinated divided by the total population, 59%, to have that many people vaccinated in really just 9 months, that is an incredible accomplishment, but it's very, very far from adequate. We've got to get that up over 90% somehow. And as we've all seen, there's great difficulties because a large subset of population has decided that they are not going to get vaccinated. And unfortunately for all of us, that not only exposes them to harm, but it exposes us to risks as well because of the difficulties that the healthcare system faces and the consequences for people even without COVID who can't get access to care. So I'm looking here, I had wanted to give you a few other little statistics here and some basic information. Pregnant women are at increased risk for complications from COVID. And remember now, there's 2 lives at stake. Vaccines, COVID-19 vaccines for pregnant women are safe. The CDC, the American College of Obstetrician Gynecologists, the FDA, and other expert bodies have all urged that pregnant women should get vaccinated for COVID-19. They should also get vaccinated for pertussis and influenza when they're pregnant because of their increased risk of adverse complications both to the mother and to the baby. We also have to attend to getting vaccine uptake to increase not only across all the age ranges, but in particular now in children and teens age 12 to 17, where it's only a 50% uptake so far. The lowest uptake, if you wanted to really take a large group of population, is the people under 30. And therefore, we're seeing that the disease rates currently are the highest in people under 30 as an age cohort. The Foundation for a Healthy Kentucky just recently did a survey and said that of the people who are not vaccinated at this point, 47% of them said they would definitely not get the vaccine. 32% stated that nothing would motivate them to get the vaccine. Only 14% said that more testing or research would motivate them. For that 14%, if any of you are listening today, I want to urge you, when I reference these statistics from the World Health Organization, 5.6 plus billion doses administered to more than 3.25 billion people. There's all the research we need. There's all the studying we need. I hope that is helpful to you and persuasive. And 44% almost of the people who are not vaccinated do not believe it will protect them against COVID, which is really unfortunate because the evidence overwhelmingly says that it does. So as we approach folks who have vaccine, some have hesitancy because they have more questions and they want to be better informed. And I think we should encourage people to be fully informed. Everyone should make a well-informed decision about risks and benefits when they choose healthcare interventions. I think that we'll continue to work as hard as we can to provide information and education because we want everybody to feel comfortable with their choice to get vaccinated. But for others, and we've all encountered friends or family members or others who just simply are not going to be persuaded, I think it's really important for us to keep in mind that endlessly reciting facts and figures is not going to be persuasive. Bludgeoning people and telling them that they've somehow made a poor choice, and certainly doing things like disparaging them individually, will not help. It'll just make them more angry, it'll dig them in deeper, and it won't help persuade anybody to this course of action. So what we need to do at this point, for those of us who have the opportunity to have difficult discussions with friends or family or coworkers, is one, we have to be willing to have those difficult discussions, even though they're uncomfortable at times and feel awkward. When we have those discussions, we have to do our best to ask open-ended questions and promote a discussion and a dialogue with them so that they can feel that they're being engaged, not that they're being lectured to. It's good for us to paraphrase what our understanding is about the many benefits of vaccination, and we should compliment when they've taken steps to protect themselves and those they care about, such as wearing masks and keeping a physical distance, but then hopefully try to then roll into those actions how vaccination is another essential part of this. We shouldn't presume that people all want to have these discussions. We should ask if people are willing to have the discussions, and if they're not, at that point in time, it may be that it's better to let the topic go. We should do our very best to be respectful all the time. It's possible to disagree with people without being disagreeable. It's essential that we work on being respectful, non-judgmental, and being empathetic, trying to place ourselves in their position to the extent we can. We really need to strive to be accurate, and that's challenging at times because even when we give accurate facts and statistics, we've all seen the ability for others at times to find a singular fact that may not fit the accurate picture and weave a story around that leads to a false narrative. So you have to listen actively and attentively and be careful for when that occurs so that you can courteously and respectfully identify when that transposition has occurred and someone has taken a small kernel of truth and woven it into a false narrative so that we can try to help deconstruct that. We also have to acknowledge uncertainty. So let me put this in context. I think, there is no free lunch. There is no risk-free path through life. And that includes vaccines. But the relative risk, hands down, says that vaccination for COVID and all of these other conditions is hands down far less risky for any adverse consequence than the incredible amount of protection and safety benefit provided to us by getting vaccinated. So I think we have to acknowledge 1 in a million is 1 in a million, which means you are far better off to take a 1 in a million risk of getting a some adverse consequence that's a fluke for the vaccine versus taking scores or hundreds or thousands of in a million chance of getting severe or permanent complications from these diseases. But we still have to acknowledge that for the 1 in a million, that is the 1 in a million, it was 100% for them. And there's sadness and all sorts of things in life, but we're not very good about judging relative risk. And in this consequence, it's hurting all of us. It's hurting in particular the folks who have chosen not to be vaccinated, whether that's for COVID or these other diseases or conditions. So I was asked to leave about 10 minutes. We got about 9 minutes left for questions. So yeah, I'm happy to take questions, Bonnie. But as I do that, folks, we all bear our responsibility in society to try to help make sure that society at large values and respects the incredible good things that science and medicine have done for society and for all of us. Immunizations are clearly one of those tremendous societal benefits and goods. Ben said at the very beginning about the concern about a burgeoning of vaccine resistance nationwide. This is a serious threat to the health of our entire community in the state, nationwide and worldwide, if we allow that to happen without taking active steps to try to persuade folks and help them feel comfortable with why vaccines are so essential and so important. And I do want to thank the Foundation for a Healthy Kentucky for hosting this forum, for spending this much time on vaccinations, because I hope it's very clear the value and importance I place on them. And I want to thank my colleagues at the Kentucky Department for Public Health for all of the incredible work they do to help support and promote vaccination. And I know you'll hear from Dr. Amy Harrington tomorrow in a more detailed way, and also that you will hear from others who will speak and give you some information over the next day and a half. I'm looking at the chat box here, Bonnie, and I don't see any questions yet, so I'm filling the time till I see them. Let me offer just one or two other thoughts. Vaccines are abundant and widely available. Right now, 2 steps for vaccination everyone needs to take to help Kentucky. Go get your flu shot this month or early next month. Go get your flu shot. That's really important. It's not a good time to have any respiratory disease when COVID is running as rampant as it is. 2, if you haven't got your COVID vaccine, although I suspect most people listening to this kind of venue, this forum, probably are vaccinated, please get your vaccine. 3, we got to wear masks when we are indoors, even if we're vaccinated, because the risk of transmitting Delta is so substantial that we all still indoors should be masked when we're around others, particularly in the school setting. And then one thing that was brought to my attention here was to comment on the boosters. The FDA met last Friday. They have only recommended so far that the benefits outweigh the risks for vaccination for a booster, a 3rd dose. They already made the decision for people with moderate to severe immunocompromising conditions, where it's not a boost really, it's the 3rd dose in the primary series. The distinction is with meaning. Those people probably never got an adequate response to the first 2 doses, so they needed 3 all along. But for the boosting, the recommendation is currently that it's people 65 and older and people who are at high risk for the most severe forms of COVID. They also discussed, but didn't really make a formal recommendation, about people who are in high risk professions. So healthcare workers would be one, but there could be others. The CDC's Advisory Committee on Immunization Practices is going to meet this week on the 22nd and 23rd. They will make recommendations, and then after that, we'll have a better idea. So later this week, we'll have a better idea about the boosters. And it is only for Pfizer. There is currently no predicted timeline for when Moderna or Johnson & Johnson will submit their data for boosters. Additionally, Pfizer, it was in the news today, has said that they have data that supports the safety and efficacy in children 5 to 11 years of age, and we'll be submitting that data. So it could be maybe in October that we have the option to give Pfizer to children as young as 5 years of age. I see there's a couple other questions I have here. So I talked about the booster. How do we address people's societal obligation to get vaccinated? Well, folks, we don't let the restaurants cook our chicken to any temperature they want. If you walked into a restaurant and they gave you raw chicken cooked to a degree, 60 degrees, you would not eat that, most likely. We don't let plumbers use duct tape to hook gas lines together because houses would blow up. We don't let people come in and wire your electrical work in your house with no experience and training because your house might burn down. We require all sorts of safety requirements, refrigeration of food, various cleaning protocols in the workplace. We require seat belts in an automobile, airbags mandatory in automobiles, all of which help to lower our risk for serious and often irretrievable catastrophic harm. I would say the COVID vaccines fit in that. Right now we have I've been in healthcare 25 years. I've never seen healthcare in as much distress and duress as it currently is. I've never seen all of healthcare across whole states on the brink of collapse in the hospitals, and yet that's where we are right now. So as far as societal obligation, I really think that these vaccines for COVID have now reached the point where it's essential everybody should get these vaccines because the consequences being borne by all of society are so adverse that it no longer becomes reasonable for society to accept those consequences. As far as when I speak about 3.25 billion people vaccinated, folks, the adverse reactions, I tell you what, you see news articles and probably hear stories in your community of people going in the hospital, going in the ICU, going on ventilators and dying from COVID all the time. And now tragically, the headlines locally are showing people in their 20s, but their 30s and their 40s and their 50s getting sick and dying from COVID. You don't hardly see any stories about people with adverse reactions. And let me debunk a myth here about the vaccine adverse event reporting system. When you vaccinate 3.25 billion people, some of those people are going to have other medical illnesses, problems, death that are naturally going to occur in a population that large. That database is anyone who has any concern can report any event into it if the person has recently been vaccinated. But the vast majority of them have no association with the vaccination itself, none whatsoever. It's purely coincidence. So I could get a vaccine and I could end up getting hit by a car tomorrow, or I could die of a heart attack tomorrow. I'm a 50-year-old male who doesn't exercise enough and probably eats too much processed food. I could have a heart attack tomorrow and it has nothing to do with the COVID vaccine. So the CDC and others, FDA, look into that data to try to find where there are actual associations, and overwhelmingly, these vaccines are safe. Doesn't mean that there aren't the occasional adverse event, and that thrombotic condition is one of those, but the likelihood of that happening compared to the likelihood of a severe outcome from COVID is far, 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 far less. I'll give one last question and I'll stop because it's now Dr. Wright's turn. There is a legitimate concern about globally about giving boosters or not, because none of us are safe until all of us are safe. And worldwide, the vaccination rates are far lower in the non-developed first world nations. And there is something of a ethical obligation making sure that everybody has access to vaccination. And so giving third doses to first world nations when many other nations have had no doses is an ethical challenge, but it also imperils us all because the disease is spreading too readily across these other populations. So that's being considered. But I think in the United States, it's very clear. If they feel the evidence says people will really benefit from a third dose, I think they'll recommend that based on the science. But let's hope we can produce vaccines in more abundance so the whole world can be protected. Thank you very much for the opportunity to be here. I appreciate it. I look forward to Dr. Wright's presentation, and I wish you all a good afternoon. Take care.